Good evening. I'm Bill King with Medcom Diabetes or Diabetics, and today is November 12th. We will touch upon type 1 diabetes and statistics. Today will be part 1 of a 3-part series. So if we're ready, let's go. Type 1 diabetes facts. There is nothing anyone can do to prevent type 1 diabetes. Presently, there is no known cure. Type 1 diabetes is an autoimmune disease that occurs when a person's pancreas stops producing insulin, the hormone that controls blood sugar levels. Type 1 diabetes develops when the insulin-producing pancreatic beta cells are mistakenly destroyed by the body's immune system. The cause of this attack is still being researched. However, scientists believe the cause may have genetic and environmental components. Who type 1 diabetes affects? Type 1 diabetes, sometimes known as juvenile diabetes, affects children and adults, though people can be diagnosed at any age. With a typically quick onset, type 1 diabetes must be managed with the use of insulin, either via injection or insulin pump. Soon, people who are insulin dependent may be able to use artificial pancreas systems to automatically administer their insulin. How type 1 diabetes is managed. Type 1 diabetes is a 24/7 disease that requires constant management. People with type 1 diabetes continuously and carefully have to balance their insulin intake with eating, exercise, and other activities. They also measure blood sugar levels through finger pricks, ideally at least 6 times a day, by wearing a continuous glucose monitor. Even with a strict regimen, people with type 1 diabetes may still experience dangerous high or low blood glucose levels that can, in extreme cases, be life-threatening. Every person with type 1 diabetes becomes actively involved in managing his or her disease. Insulin is not a cure. While insulin therapy keeps people with type 1 diabetes alive and can help keep blood glucose levels within a recommended range, it is not a cure, nor does it prevent the possibility of type 1 diabetes serious effects. You know, as I mentioned in one of the earlier video series, there are several types of diabetes, with type 1 probably being the most dangerous. We will continue tomorrow with part 2, and then the next day, of course, with part 3. Remember, share these videos with your friends, your family, and loved ones. Let's talk about this topic. Let's educate each other. Let's become aware of the symptoms, the causes, and how we can help manage if we have it. Again, go to our YouTube channel, which I will highlight with a link above the video, and please subscribe to the video channel and like the videos and share them. This is an important topic. Again, have a wonderful evening, and we will continue tomorrow. Thank you once again.